20 years ago, economists focused much more on K-12 education and what happened in schools. So we've known for a long time that what happens in schools is very important. But increasingly, people are learning that what happens before kids ever get to school is important. And we had a lot of focus on early childhood education. And I think what we've learned maybe in the last 10 years is that what happens even before you're born can be very important. And many of the things that we thought were immutable are actually effects of things that happened during pregnancy or perhaps due to maternal ill health. So these are all different points where you could potentially intervene to make outcomes better, and it's important to know which points are the right points and what interventions are the right interventions. I think we've learned some very surprising things and somewhat frightening things, that some slight disadvantages or things that seem to be slight disadvantages, like having your mother have the flu while you're pregnant at the wrong time, or nutritional deprivations of various kinds, or stress. These are all things that seem to have an impact on the developing child. I think there's a lot of evidence that certain types of interventions are effective. Partly that's because certain types of interventions have been more studied than others. So things like early childhood education for disadvantaged kids have large effects in terms of those kids' lives, higher taxes that they're going to generate, but also things like reductions in crime, reductions in teen pregnancy, all kinds of things that your average middle-class taxpayer pays for could potentially be reduced. I have a study that looked at people who were in Head Start and followed them into early adulthood, and found that compared to their own siblings, people who had been in Head Start were substantially less likely to have been booked or charged with a crime. So that's one example, but there's other examples from things like the Perry Preschool Project, which many people have heard of, again, of an early childhood intervention that was very effective. Other people have studied things like nutritional interventions. Something like the food stamp program had a positive effect on infant health outcomes. There's expansions of public health insurance, of course, which have had big effects on child health, and that seems to be carrying through into adult health and people being more productive in adult life. I would say that there's a range of things which have been shown to be effective, like early childhood education, nutritional supports, things like food stamps, things like WIC, health insurance for pregnant women and young children. Those are all things that have been shown to have a measurable impact. Another project that I'm currently working on that I'm very excited about is looking at lead. So we all know that lead poisoning is bad, but the amount of lead that children are exposed to has gone down over time, but still isn't negligible for many kids, particularly inner city minority kids. We all heard about Freddie Gray being lead poisoned, for example. And in our research, what we've shown is that programs to reduce lead have been effective, and also that they help to subsequently narrow the test score gap between black and white kids. You often find that the more disadvantaged kids are both more likely to be exposed to some kind of negative thing, certainly that's true with pollution, and that they might be more susceptible to the effects. So in the example of lead poisoning, kids who are poorly nourished are more susceptible to lead.